Teamsters1932.org.
Hey, feeling good, like I should. When in Durga, walk around the neighborhood. Feeling blessed, never stressed. Got that sunshine on my Sunday best.
Welcome back, everybody. Happy Sunday. You are listening to Whatever Works on KCAA, 1050 AM and Express 106.5 FM, the stations that leave no listener behind. I'm going to be your host tonight, Kyle Kerrigan. Sam is not going to be in attendance today, but tonight we have a very important show, of a very good foundation here with us, Destiny Care Foundation, which is a nonprofit organization whose objective is to enhance and our seniors' quality of life for the services not covered under the Medicare hospice, palliative, or home health benefits. They assist in services such as caregiving, haircuts, meals, medical equipment, and other essential needs. If you or someone you know needs assistance, please contact them. So we have Joy and Anai here. You guys want to introduce yourselves?
Yes, hi. I'm Joy, and I'm with Destiny Care Foundation. We're a nonprofit organization that has been around since 2016. We cover the Inland Empire and San Diego County. We cater for the seniors at home, especially those that are homebound, needing help. It's not easy to be alone, to be home, and not be able to live. So we're always here to support our seniors in any way and form possible. Thank you for having us.
Hi, my name is Anaí Torres, and I started with the company almost 2 years, and it's been a really nice experience working for Destiny Care Foundation. I've been hitting roads, but it's in the whole sum. It's been a great experience to be able to help our seniors in the community and the IE.
Definitely. When I first heard, when I called you last week, this was a really good organization. As the listeners have been knowing, I take care of both my parents, and my mom was in doing hospice for a while. So this is actually something that hits my heart, and it's great to know that there's a foundation out there that's, if you have a loved one that needs help or you just need help, definitely contact them. And Joy, this is your foundation?
Yes, actually founded the foundation in 2016.
Okay.
Following many years of home health services and hospice. We started at home health in 2004, and in 2012 we added hospice. And there was so much of a need for those that couldn't afford caregiver, couldn't afford basic things like transport. And we believe that nobody should die alone or die in hungry. So the foundation really came to supplement and support those individuals that had nobody or couldn't afford the basic need during their end of life or when they're homebound. Yes, that was the main reason that the foundation came on, and it's been a blessing to touch so many lives locally
definitely.
And globally.
Yeah.
And then how did you start with the
Nonprofit?
the nonprofit?
So I met Joy in one of her homes in Moreno Valley, and I started there as an activities director. So I got a ticket. In 2005, and I started working in senior homes, and I've been an activities director for about 16, 17 years almost. And I was working for Joy, and she pulled me to her nonprofit, and she's like, you got this. And my passion's always been with seniors. I have learned a lot of things through them, which life experiences, and their struggles as well, and just been promoting daily quality, of life. Definitely. With activities. And that's my passion. I love doing that. And so when I got introduced to Destiny Care Foundation, a lot of the meals weren't there, haircuts weren't there. And so I started, marketing, talking to people, going out there in Moreno Valley and introducing Destiny Care Foundation. And I bumped into a lot of roads, a lot of closed doors, but I didn't give up. And I continue, knocking on doors until they opened up. And I knew a lot of the barbers. So I said,
Okay,
can
yeah.
you guys help? Can you guys go out there and cut hair at their homes for a low cost?
Yeah.
And one thing was like getting the word out there.
Okay, yeah. No, marketing is always, I feel like, the hardest part of the whole journey.
Mm-hmm.
But and like I feel like you're very personable, so it might come easier to you. But when I started, I was very shy, and I decided to get out of my comfort zone, and I went into marketing, which was not a very good idea for someone to be shy. But
I was shy
that's
too.
great.
I was shy.
Okay, yeah.
Yeah, I was shy because just asking for people to do donations
Was a
or
lot,
give
huh?
donations. Trust me, a lot of people, they're like, who are you? What
Yeah.
do you want this for? And just
Yeah.
starting mentioning it's for seniors. Not everything gets covered by insurance. And just getting the help to be able to help those in need.
Okay. So, let's say a senior comes up, or they need help. How would they approach you? Like, do they just come up to you? Here, I need help. Here's my medical bills, or here's my, Medicare statement. What can you guys do for me?
No.
Okay.
A lot of the seniors don't want to ask for help. It's mostly our people outside in the
Okay.
community, which are our hospice, CNAs, LVNs, and also our chaplains, our social workers. And then they just be like, hey, I'm calling in. Or they fill up a paper saying, I want to adopt a senior. And then they provide their specific critical condition
Okay.
and how they need help and how can we sponsor them.
So I can adopt a senior and help them with their needs.
Mm-hmm.
Oh, that's amazing.
Yep.
That's cool. I actually haven't heard of anything like that.
Mm-hmm.
It's usually just donating money or. Do you hear anything back? Like, if I were to adopt a senior, like, do I get to meet them, or is that all because of HIPAA?
Mm-hmm.
Oh, okay.
Correct.
Yeah.
So we do give out pictures, but the patient has to, our senior has to be aware that we are giving information out.
Okay.
So yeah.
Yeah. Do you ever meet people that are like, hey, I want to help out, or I want to meet the people that I'm sponsoring?
If I can jump in
Yeah.
there.
Yeah.
We have met a lot of people that do send letters
Oh, okay.
and to really appreciate the help that they get. But we've not really had seniors wanting to see those. But we
Okay.
do have a way of getting their pictures or getting their information
Okay,
where their
that's cool.
sponsors can connect with them
Yeah,
and reach out to them. So like Anahi was saying, it's not only the people that are on our service that can benefit from these services. Anybody that would go to our website, destinycarefoundation.org, they're able to ask for help.
Okay.
We've met people in different locations, like senior centers, like different locations, and they're still able to ask, and it goes case by case that we can try to meet their needs according to what they're looking for.
Okay. And it's usually like a in-person conversation, because I'm assuming a lot of seniors don't have the capability for internet or try to go to the website.
Yes, they can also call on the phone because we do
Okay,
have a toll-free number that they can call.
Okay. What's
You
that
know,
number?
that number is 877-503-8415. And that's
Okay.
24/7. If they call, they can leave a message. At least hopefully everybody can have a phone call today.
Right.
And we
Okay.
always would reach out back to them to see how we can help them meet their needs.
So you guys are based out of Moreno Valley, correct?
We're out of Moreno Valley, right off Paris Boulevard, and
okay.
we cover all the way to Banning, Beaumont, the desert, which is Palm Springs, Indio to 29 Palms. We cover all the way from Temecula on 215 freeway all the way to Corona, Pomona, Ontario. So to be precise, Inland Empire,
Okay, yeah.
where anybody need our help, we're able to do that.
Okay. And what are some of the qualifications for seniors to join?
The qualifications will be a senior that do have need.
Okay.
We would not be buying medication if they have insurance that can buy medication for them. So if they have in-home supportive services, unless they need more hours, we can supplement that.
Oh,
but we
okay.
go for people that do have the need for caregiving or can't go to the grocery to buy food. So NIE helps a lot with, getting warm meals, delivering to the home for them, or fresh vegetables delivering to the home. So again, we're looking at basic needs that some people take for granted, that
Right.
is really important for a person to be able to live day by day.
Okay. And then for the people who are in like assisted living facilities, is it like the nurses that kind of sponsor them, or is it, is it the patients that actually go to the website for help?
If they live in assisted living facility, often at times they do have 24/7 caregiving there
Okay.
because there is
Oh,
somebody
gotcha.
there.
Okay.
So our goal is that no one dies alone, no one be left alone in the home where if there is fire or something they can leave.
Okay.
So assisted living facility, we would help like with meals, holiday meals, stuff like that.
Okay.
During special
maybe the
time,
haircuts and stuff.
birthday, haircut,
Okay.
yes. Things like that. But they can reach out to us directly or we also go through the team to meet with them.
Okay. That's amazing. Yeah, no, this is a really good program. And if you guys have any questions, by the way, for either Joy or Anais, you can call in at 888-909-1050. That is 888-909-1050. And then what was the number they can call in again for the help?
That number is 877-503-8415. We're 24/7. You'll be able to speak to somebody anytime they call.
Perfect. And then you could also go to the destinycarefoundation.org and fill out the information there, correct?
Yes.
Yeah, awesome.
Yes.
Okay.
We have our Facebook, our Instagram as well.
Oh, perfect. And
Yeah.
what's the Facebook and Instagram?
Our Facebook is the same, destinycarefoundation.org.
Okay.
And then our Instagram is Destiny Care Foundation.
Awesome. And how long have you guys been promoting on like social media itself? Like,
Well, when we distribute meals, we try to post
Okay.
with patients' consent.
gotcha.
Mm-hmm.
Okay.
Every Tuesdays, let me talk a little bit about like on Tuesdays that I volunteer.
Yeah.
I volunteer at a IHP and Bienestar is a Spanish foundation. So I volunteer there and whatever I can grab for our seniors that I take in Paris. It's about 70 now.
Oh, wow.
So yeah, we take perishable vegetables like fruit, any type of fruit. It could vary within the week. Vegetables as well, and I
Okay.
put them all in a bag. I take them to the senior center, and they already know. They're already waiting for me out there at the door, and we're able to help our seniors in
That's
that.
amazing.
Yep.
Yeah.
Mhm.
And as for the volunteers, how would someone want to come up and volunteer?
Usually the volunteers that I get are that have seen me out there in the community. For example, at Tuesdays in Paris at the food drive, they're like, you go all out and above and beyond. And I'm like, because I have a passion and there's a lot of people in need, and especially your seniors that can't get out to go shopping
Oh,
and
right,
be
yeah.
out there. It's a struggle for them, not for us. For, have all the energy in the world.
Yeah.
But not them. Sometimes they're connected to an oxygen, their medication. They get tired. So we try to help them a little bit at a time.
Yeah, that's amazing.
Yeah.
But yeah, no, it's definitely really cool. Like when you're passionate about something, it's addictive. Especially to other people.
Yeah.
Because they want to feel that way too, or want to help out, but don't know how. Usually people are in a financial state where they can't. In this state specifically too, but as my dad used to say, time is more important than money. And
Yeah.
so,
Time is more important.
you know, donating your time and also donating, you know, in other ways like, you know, paying for the food or sponsoring a senior, I think is really great too.
Mm-hmm.
But no, this is amazing. I'm surprised I haven't heard of it, you know, because, you know, through my mom or, you know, just in general, you know, with hospice, you know, I think it's really important. And seniors have a lot of crazy stories too.
Yes. Yes. And,
You
and
know?
I'm sure Joy can share one
Oh
that
yeah.
she touched a lot of people. And she's been on this company for a really long time.
Yeah.
And maybe she can tell you how we got started.
Okay.
Thank you, Anai, for putting me on the spot. Listen,
tell it better than me.
I'm very passionate about seniors. You know,
Yeah.
a lot of people say, "Do you take care of children? Would you do kids or youth?" You know, our passion is for seniors. You know, most of our seniors have paid their dues, whether they were housewives, just taking care of children, you know, doing the work at home, or they had jobs that they cared for other people and do different things. So for the
Yeah.
seniors, it's just a passion that sometimes you go to the home and you realize that you have a 90-year-old and a 95-year-old. That's all they got. Some of them, their children are in East Coast. They're not close by.
Right.
Life is hard. So for those that would really like to touch the lives of seniors at home, you know, this would be a perfect opportunity for you, you know, because seniors do need somebody to read for them, sing for them, watch television with them. You know, today it's hard to write bills, you know, pay bills, or even to follow those things day by day. We see medical bills stuck in one corner. So that's what a volunteer can do. You know, what we do is that we go from personal care to doing exercises, social workers for finding caregiver for them, how they can eat food, medication. So there's so many things that could be done to impact the quality of lives of our senior. So we're really passionate about it. When you call that number, please don't say, is this hospice? We're all connected.
Yeah.
We do hospice, we do home health, we do palliative care. Just say you want to volunteer. You want to help a senior, you want to make changes in their life. You want to impact their quality of life. Guess what? Sometime we're all gonna be seniors. And if we would love to get this help and support, this is a perfect opportunity to do for somebody else.
Definitely. Yeah, no, I take care of both my parents, you know, and all my siblings are on the other side of the country.
There you
So
go.
I'm pretty much the only one here. But, you know, we get by and we take care of each other, and, you know, it hasn't gotten to a place where we need immediate help, but, you know, it's always great to know. And I'm definitely going to be contacting you guys in the future, because I definitely do want to volunteer.
Awesome.
Yeah.
Awesome.
But yeah, because, you know, I actually do like talking to older people, you know, because they have it's such a different way of life. You know what I mean? And the experiences that they have, like just talking to my dad or even my mom about how things were back then, you know, because, you know, I was born in 97. And a lot of things have happened before then, you know, especially throughout history that they've lived through. And, you know, I think it's most important that they get as much life as possible, because, you know, one, they deserve it. And two, you know, a lot of people don't realize that they're people too, you know, especially, you know, growing up, I had to make a decision on whether I had to quit college or take care of my parents. And so, you know, that's a decision everyone you know, hopefully everyone doesn't come to that crossroad, but when they do, you know, they know that there's help out there. Or if, you know, if there's an opportunity that they can't take, or whether they have to take it and need help for their parents, or that there's something out here, at least in the IE.
Yeah.
You
We're
know.
here to help.
And so, yeah, that's amazing.
Yes.
But what's that story about starting? Yeah.
Yes. She has to.
That story about starting is that I've been a nurse for 35 years plus
wow,
right
okay.
now.
Yeah.
And because I've worked in different settings where, whether it's delivering babies or doing surgery in OR or taking care of broken bones, surgery, and so on, I come to realize that taking care of somebody in a home setting is one-on-one, where you deal with one family at a time and then one patient. Your undivided attention is there, and you take care of them, you listen to them, you come up with the plan together, and boy, it is like you leave that home knowing you have touched somebody's life. You have made changes for somebody that would have still been in the situation of not knowing, because, when, like you're saying, you help your parents by making that decision.
Right.
But there are so many people today like that doesn't have a kid, doesn't have anybody. They just see themselves in a situation that until you hear their story,
Right.
you see their journey, you see who they have been, because we take care of doctors, lawyers, nurses, businessmen, people in the Congress, so everyone, musicians, actors and actresses. So until you hear their story, you go, this life, everyone is going to need someone at some point in their lives.
Right.
So how we started this Destiny Care Foundation was from the popular demand when we saw the need in the home of people that were there, live alone, couldn't get out of their bed anymore, couldn't get one meal to eat because they were sick, couldn't take care of their own basic needs of bathing, dressing, or, just being able to go to the doctor or go get their medication. We decided that the foundation would be good, where we can reach out to the community to get support so we can help these people. Even telling our other patients that are able to provide the resources to help those that could not. So we needed a way to spread that out, that, all fingers are the same. If you can adopt a senior, if you can help a senior, join us. Let's do it together.
Mm-hmm.
Definitely. Do people get confused, like adopting a senior, like oh, I'm gonna pick him up, or?
You know what? That's a very good question. No, adopting a senior just being a part of somebody's life,
Right. Yeah.
knowing their story, knowing what is going on, and how you can make an impact in the life of that person. Whether it is one day a week, pick groceries and drop, or I'm gonna deliver that meal every Tuesday. Get meal, drop off in the home for that senior. That's how, we get through being able to adopt a senior. Everyone have different needs.
Right.
So just being able to get them to meet their basic needs is how we can adopt our seniors, not moving them out of the home or residence that they love and live in.
Okay. Do you ever get requests like, oh, the senior wants to go out and have fun, or do?
There are some of them that have those last wishes. I want to be able to go to the zoo one more time.
Yeah.
I want to go to the lake, I want to go to Disneyland, Some of them have a lifestyle that they've been used to when they were young.
Right.
And they hope that they can do that one more time in their lifetime. Yes, we do have that a lot. And we try our best to see how we can meet those seniors' needs.
Yeah. Like I was telling Anais, my dad was he was a master electrician, master carpenter, and he got sick at 41. He had a heart attack and stroke. And he has drop foot, a whole bunch of other stuff. And so every once in a while I catch him on a ladder. I'm like, you can't be doing that.
Oh, my goodness.
And so every once in a while, it gets to him. And so I'll be like, hey, can you build this for me? Yeah, sure, yeah. And he'll do whatever, whether it's cabinetry, because he specialized in like custom cabinetry for years.
Wow.
And so I'll go like, oh yeah. So I'll just bring random stuff to him and be like, hey, I need this built, and just so he feels like he's doing something. But it's hard because sometimes I work from like 9 a.m. to 6 p.m. someday, and I'll see him on a ladder. I'll go home. I'm like,
Wow. You know, that is what we call life review.
Yeah.
Because that was what he did.
Yeah.
And he know that we meet some people that were teachers in their background, and they love to teach.
Yeah.
So you're like, okay, what are you going to teach me about today? You see their face lit up because then you bring that memory back to what they used to do. So that is so nice that you're giving your dad that task, still being conscious of that, his abilities and who he was and what he used to do. You know, so bring that back, really create memories. There are some people that were like the, you know, the 80s music and so on. You go out there, you start singing that music, they lit up and wake up. So, you know, so that is so good. You know, seniors are unique, and we want to help them as much as possible.
Definitely. I have another story about my my friend's great grandma. I call her my great grandma because their family pretty much adopted me. But before she passed, she had really bad dementia and like couldn't speak. But I remember her granddaughter, which was my friend's mom, you know, talked to me about how she always used to make like a key lime pie. And so I baked it. And as soon as she smelt it, there was a story. And she was telling me about her childhood. And her mom or her granddaughter was like shocked. Like she can get the story out. And I was learning, I was like, because smell is one of the last senses that goes.
Yep, that's right.
And so if you can bring something like flowers or even like, you know, warm food, something they like, something they grew up with, like in the culture, that's how you can get them, like, you know, get that brain working a little bit. And so I learned that. And so before school, I used to go to my grandparents' house and cook them breakfast, you know. And they used to talk about when they were younger, you know, how my grandma grew up in Mexico. And she used to talk about that. And then all of a sudden, she doesn't remember that story or remember that part of her life. And that was just, you know, that's just how dementia goes. But, you know, it's definitely cool to see, you know, some of that come back, especially in the senses, you know. But do you have any specific stories or memories of like specific patients that like, oh, this is like odd, but this is what they grew up with? So
you know, we have so many of those.
I'm sure, yeah.
Now you're talking about dementia. Oh my goodness, you know.
Yeah, I know it's a big rabbit hole too, but
It is.
I tell you, there are some people that are going to remember what they did as a child. That is the long-term memory, but then they don't remember what just happened.
right.
So they can tell you all their life story, that they were dancers, they were in cheerleading, you know, they were doing this and that. And, you know, the memory that I know is like you're saying, it's like you cook their favorite meals and bring in, and you see them wake up. And literally go, did I just cook that? That looks like the one that I cooked. So that brings that memory right back out, you know, for them. So, you know, those memories, I mean, we see so many different people, like you come on in, you play the music. If they were musicians, you put that music on and you see them wake up and start singing that they were not talking or doing nothing that was going on. So that brings right back that memory, and they capture the music even though they're not talking. But they get that, they start singing right away.
Yeah.
So live review, and, you know, is very important with dementia.
Oh, definitely. Yeah. And then, you know, that also creates memories too, whether it's with your patient or with one of your loved ones, you know. That's something that you could always share.
Absolutely.
And so, but we're about to go on a 5-minute break. And as soon as we come back, we'll continue talking with Joy and Anais about Destiny Care Foundation. Please stay tuned, and we'll be right back in 5 minutes.
Hey, feeling good, like I should. When in dark, walk around the neighborhood. Feeling blessed, never stressed. Got that sunshine on my Sunday best. Yeah.
From the Bureau of Economic Geology, this is Earth Date. In 1816, half a foot of snow fell in New England. That would be completely unremarkable, except that it was in one day, in June. The same summer, Mary Shelley spent a chilly vacation holed up indoors and used the time to write Frankenstein. Crops failed around the world, plunging Thomas Jefferson into serious debt for the rest of his life. Oats became scarce in Germany, making horse travel expensive and leading to the invention of the bicycle. Struggling farmers in China began raising opium, giving rise to a drug trade that has lasted to modern times. And famine in many areas led to widespread disease, including a cholera outbreak that killed millions. What was the cause of all this chaos? A year earlier, a volcano erupted in Indonesia. Larger than Krakatoa, Vesuvius, or Mount St. Helens, Mount Tambora erupted for 2 weeks straight. Around it, nearly 100,000 people died, buried under thick layers of ash, like in Pompeii. Greenhouse gas emissions from the eruption, which could have warmed the atmosphere, were offset by particulates and sulfur dioxide gas. Ash and dust blocked out the sun temporarily, darkening skies around the world. The sulfur dioxide was longer lasting, becoming aerosols that reflected the sun's heat for 3 years. This turned 1816 into the year without summer, as it was called, with long-term global effects. The good news? The atmosphere recovered within a decade, and life went back to normal. I'm Scott Tinker.
Earth Date is produced by the Bureau of Economic Geology at the University of Texas at Austin. Earth Date is researched by Julie Hennings, written by Harry Lynch, and distributed by Mark Blunt and Casey Walker. For more stories, follow us on Facebook or visit earthdate.org.
In these trying times, many people are depressed and lost because the future of our society is up in the air. If you're turning to substance abuse because you're feeling there is no hope, we have a way for you to see the light. SAD, or Stop Abusing Drugs, is a nonprofit organization that will help you at no cost to you stop abusing drugs. Founded by Tony Navarchi, SAD will refer you to the top detox doctors in your area. SAD will pay every and any cost for you, including doctor visits, counseling, and medications. If you need help, SAD is there for you 24 hours a day, 7 days a week. If you or a loved one needs help, or if you have a suggestion or idea for Tony, you can reach out to him by calling 844-493-3386. That's 844-493-3386. Or email Tony at tony@saddetox.com. That's Tony at saddetox.com.
Hi, I'm Lanny Swerdlow, and I'm back on KCAA 1050 AM and Express 106.5 FM every Tuesday at 8 p.m. My show is Beyond Common Sense. It's Lanny Sense, featuring me, Lanny Swerdlow, KCAA's resident gay, Jewish, liberal, pot-smoking, race-mixing, left-handed atheist, an evangelical, fundamentalist, Christian, nationalist, worst nightmare, with subjects that no one else will touch in quite the same way. Every Tuesday at 8 p.m. on Express 106.5 FM, the Legacy 1050 AM, and live streaming on KCARadio.com.
And now, the voices of KCAA with an exciting announcement.
Want to hear NBC News or KCAA anywhere you go? Well, now there's an app for that.
KCAA is celebrating 25 years and our silver anniversary with a brand new app.
The new KCAA app is now available on your smart device, cell phone, in your car, or any place.
Just search KCAA on Google Play or in the Apple Store.
One touch and you can listen on your car radio, Bluetooth device, Android Auto, or Apple CarPlay.
Catch the KCAA buzz in your earbuds or on the streets, celebrating 25 years of talk, news, and excellence with our new KCAA app.
Just do it and download it.
KCAA, celebrating 25 years.
Hey, feeling good, like I should. When in dark, I walk around the neighborhood. Feeling blessed,
Welcome back, everyone. Happy Sunday. You are listening to Whatever Works on KCAA 1050 AM and Express 106.5 FM. The stations that leave no listener behind. I am Kyle Kerrigan, the host tonight. Sam is off. He should be back next week. But tonight we have a really special show with a very awesome foundation. If you missed the show, the first half, you'll have to go back and rewatch it on kcaaradio.com. The Destiny Care Foundation, it's a nonprofit. Objective is to enhance senior quality of life for services not covered under the Medicare hospice, palliative, or home health benefits. So they assist with services such as caregiving, haircuts, medical equipment, and other essential needs. But we have Joy and Anais here representing the foundation. They're locally in the IE, based out of Moreno Valley. So if you haven't been listening or just tuning in, you'll have to catch the first half. It's very important, and it's a really good organization. But so all right, so just circling back, what future plans do you guys have with the organization?
Ooh, Joy has a big plan.
Okay.
She wants to open up a big facility to be able to help more seniors in the community in the IE. That's what her goal is. And I'm trying to make it happen.
Do you want to elaborate more on that?
Yeah, absolutely. We're getting a big office where we can host seniors. They can help. Other seniors can help seniors. A facility where people can come on in and share ideas, support each other. Really coming in and just hanging around, maybe, putting together knitting stuff and donating, blanket, towel stuff to other seniors. So we cannot wait to get that. So that facility is already in the city of Moreno Valley and waiting for the permit. So we're hoping very soon we're going to be opening that solely for Destiny Care Foundation.
Okay. Is there somewhere where people can help out, or do they call in or just come by the?
Yes, it would be open to the public. 8:30 to 5. That they can come on in and help or make phone calls, volunteer, and help other seniors as needed.
Okay. Is there somewhere where someone can come in and help you achieve that goal now, or?
Absolutely. Even now, we still have room. If somebody wanted to come in to help a senior, spend a few hours here and there, we would love that because there is always need, to drop a diaper, or to take food, or to take fruit, or to take stuff to them.
Definitely.
And if they want to be able to contribute, they can also do it at our Zelle number. We have a PayPal, or they can send a check. And our Zelle number is 951-616-7625. So we can be able to help more seniors in the community. And also to help our building get bigger.
Oh, definitely. Okay. Yeah. And you guys can all find this out also on the DestinyCareFoundation.org.
Yes. And our Instagram. That's where I post everything.
Yep. Definitely follow them on Instagram, Facebook. And definitely reach out. You guys don't have to just donate money. You could also donate your time. And and I know there's a lot of people out there, a lot of our listeners out there that do want to help, but feel like they financially can't. So there's one way you can help is by either adopting a senior, or you can go out there and there's
take
always
meals
something.
To our seniors.
Take meals, or just donate a little bit of time. And
read a book.
Yeah, definitely read a book.
Or just be a companion, one-on-one.
Yeah.
Yeah,
it's amazing.
This time, a lot of them are just with their phones.
Right.
Yes.
Yeah.
And we need that one-on-one contact, person to person, face to face.
Yeah, definitely.
We do.
And, I think it's more important to, we're just coming out of COVID, people need to be out there and socialize more, I feel like. And I feel like a lot of people are realizing how precious life is, especially after the virus.
Yeah.
And it hit our seniors a little bit more harder, unfortunately. But so we got to take the initiative and bounce back and help them, continue living life, the one that they have already been living longer than us. They're already more experienced than us.
Mm-hmm.
I think, the least we can do is help them out.
Mm-hmm.
Absolutely. COVID was an eye-opener. I don't think we've had anything like that in our lifetime.
Right.
But I tell you, for us that were home from home, home to home, helping these seniors, it was one of those experiences that nobody want to live again. But again, at that time, what Destiny Care Foundation did was to, first of all, call to be sure a senior is okay, that they do have food to eat, because even just a phone call wasn't there.
Right.
It was, people were so scared. The seniors were scared of any visitor coming in.
Mm-hmm.
Visitors were scared of going into the home to see the seniors. So you can imagine being homebound during COVID.
That's rough too.
It was, people died because they couldn't go see their doctors. They were afraid.
Right.
They didn't want to go to the grocery store to buy food, or restaurant were closed. So it was really one of those experiences that everybody thought it wasn't going to go away, but we're back. Let's get back to helping our seniors.
Mm-hmm.
Let's help them. Let's make life worth living. Let's help them enjoy lives, by everybody tipping in one way or the other.
Definitely. And, like I said before, DestinyCareFoundation.org has all the information you need. You can call in, definitely help out. You don't just have to donate money, although money does help.
Yes. Then also I want to mention something really quick.
Oh, yes.
Our company, Joy's company, has made it to 20 years.
Wow.
And we're doing a big event. We are hosting a gala night on July 27 at 5:30 at Parkview Medical Center at 3865 Jackson Street in Riverside, California, 92503. And you'll see this on our website as well.
Okay.
And Destiny too. And it's 20 years that
20 years.
Destiny has been around.
That's
helping
amazing.
our seniors.
Yeah. Yeah, that's incredible. I wish, especially in high school, if I found out about this, I definitely would have been helping out too in high school.
In high school, yes.
Absolutely.
Yeah. But, 20 years is amazing. And the gala is what day again?
July 27.
July 27. Okay. So you guys can get that information again on DestinyCareFoundation.org.
Mm-hmm.
Sign up. Do they have to sign up or RSVP?
RSVP, yes.
Okay. So just RSVP for the gala.
We have a great dining, food, entertainers, and great DJ.
Okay. There you
to
go.
make it fun. And we're going to do a lot of raffles to raise money for this.
And this is also, for the listeners out there, a great opportunity to meet Joy and Anais too.
Yes.
Absolutely.
Come on over.
And every produce from this gala night will go to the foundation to help seniors. Mm-hmm. So this is really an opportunity for us to raise money and help as many seniors as we can in our community.
Mm-hmm. Okay, definitely. Let me see one of the flyers here. Awesome. Okay. Yeah, so we'll post this on our website and we'll mark it and push it out too.
Thank you.
And if you guys want to stop by our location, which is 12364 Paris Boulevard, Moreno Valley, California, 92557. And
Perfect.
I'm there. Joy's there.
Yeah, no, so definitely stop by, introduce yourselves.
Yes.
Say you're from Kyle and Sam and stop in and help out. There's definitely more than one way to help out, as we've talked about before. And then we got the gala coming up, so we'll be pushing that. But, is there anything else that you guys want to say before we close out the hour in 10 minutes?
We really do appreciate KCAA, 1050 AM and 106.5 FM for giving us this opportunity to share what we do in our community and for having us as a community member, to come in and share with everybody what we do at Destiny Care Foundation. I think together we're going to impact the lives of our senior citizens, helping them improve their quality of lives. So when we get there, We're going to just be seniors one of the days. So we thank here the radio station for the opportunity, and we hope to continue to work together to improve the lives of our senior citizens.
And spread the word.
Yeah, definitely spread the word.
Spread the word.
Yeah, so we'll be on Instagram, and then we'll be coordinating with Destiny Care on the gala, and definitely if you guys can stop in, especially at the Moreno Valley location, just introduce yourselves. See how you can help out. There's always something you can do. Again, you don't have to pay, you don't have to drive. There's always something for somebody, because there's always a need for somebody.
Yes.
And
make someone happy.
Yeah, definitely.
Bring a smile to our seniors. Yeah. And a lot of the seniors they're going to be retiring. Our baby boomers are coming.
Yeah.
So they need a lot of help. So just spread the love.
Yeah, definitely. What's besides the location that's coming, where do you guys see yourselves in like 5 or 10 years from now? Besides.
That's a good question.
Yeah.
In 5 to 10 years, we hope to continue to partner with KCAA,
definitely.
1050, to help as many seniors as is possible in Inland Empire, San Diego County, LA County. We just want to be able to spread, and love our seniors, because together it takes a village to raise and take care of the seniors.
Yeah.
We want everybody to join us. So we're hoping to help many seniors than we are doing right now in 5 years.
Okay.
And those are phone calls. There are some people that, to be honest, when they pass on, they don't have money for cremation. That's what we do. We help get caregivers to stay with them so they don't die by themselves. We help bring warm meals so that they don't starve while caring for a loved one that is dying.
And medical equipment.
Medical equipment, walker, wheelchair, commode. Basic things like that we take for granted. So that's what we want to do. We want to continue to do more of those and help the seniors so that they don't feel alone.
That's amazing. I think, this is probably like one of the best foundations I've ever heard of, especially in our Inland Empire. And I think it's very important. And I could just be biased because of, me taking care of my parents and grandparents, but this definitely does touch my heart. And, and I want to thank you guys too for everything that you guys done too. What's the biggest need that seniors have?
Caregiving.
Caregiving, okay.
Caregiving. When somebody is dying and they have a spouse who is also elderly, maybe sick and frail, you need another person to be in the kitchen to cook meal, to bring fresh food, to be there to say, okay, go to the bathroom. I'm going to be here. Because when somebody want to die, their loved one don't want to miss the moment.
Okay.
So caregiving in what form or the other is what we need the most.
Okay. And then another question I have is, like, on the senior level, what's the hardest thing that they ask for? Like, what's something that they need help with that, like, you got to kind of get it out of them? Or maybe that, they finally comes to the conclusion that they need help. What's one thing that, that they don't know they need, but they do need it, besides the caregiving?
That would be giving up their independence. For somebody to say, I can no longer control my urine or poop. I have accident. It's so hard for them.
Right.
So you have to find a way to get there to get the answer to that question.
Right.
So they're ashamed to say it. They don't want to say it.
Right.
But sometimes we know right away when we walk in the room, because you can smell it. That's going on.
Yeah.
So you have to also have the sense of humor and dignity to be able to not embarrass them, but to find the solution for them, which is very basic. Hey, especially ladies, after having babies, you're going to have those accidents. It's normal. The key is, let's help you, keep you clean. Let's maintain that dignity. Let's help you to continue to enjoy life.
Yeah, so just kind of breaking down that stigma that, help is, it's not just good for you, but it's necessary.
It's
Yeah.
necessary, yes.
You know, and I feel like the older generation, like sometimes when my dad's doing stuff, you know, I gotta. You need help with that? No.
Yes.
Okay.
Yes. It's
That's right.
independence.
Yep.
They don't want to lose it.
Yeah.
And us too. We want to be independent, but
Yeah.
Mhm.
And so, you know, I think it's great. And just kind of breaking that stigma too, and you know, and I feel like that falls over time, you know, when they start to trust you, and you know, whether you're helping them out or, you know, because sometimes you find help in the most unrealistic places too. You know, you could be bringing them groceries, and then they start telling you a story. Hey, this happened. I don't have anyone else to talk to. And then you kind of have to, like, you know, step back and hear them out and appreciate that they trust you. And so I think that's the biggest thing too.
and it's hard for us too, just to let go.
Yeah,
and
definitely.
when they pass away, it's hard on us too, because we
Oh,
get
yeah.
attached.
Yeah, and you know, I don't want to keep calling my mom out, but you know, she was in hospice too, and I can't remember the patient's name, but he lived right here by Loma Linda, and she took care of him, and he passed away eventually. But you know, we're still cool with the family, and we hang out every once in a while. And she's best friends with the daughter, and you know, so it's always great to like maintain those connections too. And I feel like, you know, some people who aren't willing to help out, and unfortunately their loved one does pass, and it does dawn on them, maybe I could have done something, or maybe, you know, maybe I should have stepped in. And I feel like you don't have to be alone. Even if you are a senior or you're not, I feel like this foundation is here for everybody. And so,
Yeah.
you know, whether you want to help out, you know, you were in that situation, or you want to kind of understand the situation too for other people. I think the foundation can equally help you than the senior. And so, you know, it's really great to have you guys on, Joy and Anais, you know.
Yes, thank you. Thank you for opening the doors.
Yeah, of course.
And follow us. Follow our website at www.destinycarefoundation.org. You'll get all the information there.
There you go, www.destinycarefoundation.org. All the information there. Social media. The gala is coming up July 27th at the Founders Center in Riverside. And the phone number for seniors again was the 877.
That phone number is 877-503-8415. 24/7.
24/7. If you need help, or your loved one needs help, or you know someone, your neighbor, you know that might need help, definitely call in. And yeah, definitely follow up www.destinycarefoundation.org. Thank you guys for listening. Thank you guys for coming on.
Thank you.
And we'll see you guys next Sunday, and stay blessed.
Yes.
Hey, feeling good, like I should. When in dark, I walk around the neighborhood. Feeling blessed, never stressed. Got that sunshine on my Sunday best. Yeah, hey, every day can be a better day despite the challenge. All you gotta do is leave it better than you found it. It's gonna get difficult to stand, but hold your balance. I just say whatever, cause there is no way you're around it. Everyone falls down sometimes, but you just gotta know it'll all be fine. It's okay.
A journey of 1,000 words begins here. KCAA.
Hi there, this is Chris Klein, investment manager for Capstone Wealth Management. Hey, I've been through the early 1990s bond market implosion, the late 1990s stock market melt-up, the 2000 to 2002 dot-com crash, the rate hike scare in the mid-2000s, the great financial crisis, the pandemic-induced 2020 collapse, the inflation madness, and, of most recent memory, the 2022 bear market. You know what all these have in common? We helped people just like you navigate their finances through. Hey, my boys say I'm old, but I say I'm battle-tested. Not only that, but I've seen the underbelly of Wall Street, and I know